microphone on. Hello, everyone. Please take your seats. Welcome, everyone, to the ALMA Laser Symposium in IMCA's Asia 2026. My name is Dr. Dean Berman. I am the Global Vice President of Medical for ALMA Lasers. And I'd like to welcome you to a very exciting hour where we have a fantastic lineup of doctors from all across Asia to share with you some of the highlights in our products. But before we're getting started, just a few words regarding ALMA. So I want to believe that everyone in the room know ALMA very, very well, but just in case you were living under a rock, so ALMA is an energy-based device company that has been around for over 25 years. We have multiple technologies, but we are also supporting in innovations because innovations runs in our blood. And the latest innovations, for us it's not latest, it's part of who we are, is the transition of aesthetic medicine into the world of longevity. So as you know or you don't know, today we are actually defining longevity by 12 hallmarks of aging. And funny to think that when we think about those 12 hallmarks of aging, what we're doing in ALMA actually is that we were able to provide answers to each one of those 12 hallmarks, based on our devices. So you can see here on the screen all of the devices that we are carrying. Actually, we're carrying more, but those are just examples of devices and exactly the hallmarks we are addressing. Because what we are trying to achieve in ALMA is to improve the quality of the skin span, the quality of healthy, good skin among our patients. And this is what you will see with our faculty today of exactly what they are trying to do. But we also need to understand something even more impressive, that the way that we look at things today in ALMA is that longevity medicine is aesthetic medicine. Because when was the last time that you looked at someone and said, oh my God, look at their amazing liver or kidney functions? You don't. But you look at patients, you're saying, look at their amazing skin. And this is exactly what we're trying to do here, but we do it with multiple modalities because this is exactly what ALMA are trying to achieve. We are no longer just energy-based devices. We are providing also injectables with partnerships of the best, skincare with the best of the best, because this is what the aim of ALMA is, to help you and to help your patients to improve their skin quality, the skin span of their good years of skin quality. Now we'd like to invite our first speakers to the stage, all the way from India, Dr. Malvika. Please, let's hear for her. Thank you very much.
Good morning, everyone. Thank you for being here, and thank you, ALMA, for this wonderful opportunity to share my experience with the lady of our clinic, ALMA Harmony. She's a black beauty. I've actually had a great journey with ALMA Harmony, starting with the Pro in 2008. And then 8 years later, we got the Pro XL, and today we have the ALMA Harmony in her full glory. So let's share today on how I have progressed in my clinic, because this wonderful platform has so many multiple powered handpieces which deliver such focused energy that I'm able to treat a multiple variety of indications. And I have very happy patients, because in skin of color, your highest concern is patient safety and PIH. Including the fact that it can treat PIH, is that today I will concentrate on acne scars, post-acne PIE and PIH, and pigmentation. So this is the focus of my lecture today. So let's start with acne scars, and today it's called Superb, the 2940 Erbium YAG ablative laser, which works with a photo-ablative effect. And this has stood the test of time. It has given great ablative results with really minimum to no PIH in my patients. When I say minimum, it's a patient who's either not compliant or may not have been primed too well, something that we've learned over the years to do really well. As we know, the target is water, and depending on the energy you use and the number of stacks you give and the passes, you can achieve a depth you desire. So most of our patients of acne scars have multiplicity of scars. So this helps you to customize and tailor, even when you're doing the procedure on the patient, which scar you want to give more stacks, more pulses. If you want to go deeper, then you can do so. Sorry, this it's not working here. Yeah. You can go deeper for the deeper scars. You can go more superficial when you want to pass it all over evenly. So you can give multiple passes evenly to cover the entire area, and then you can stack on individual scars. You can vary the energy depending on the depth you wish to achieve and the kind of ablative effect you wish to achieve. So a lot of customization and tailoring helps us to give our patients a more overall blended in result. We know that 2940 erbium yak targets water in the skin, especially in the epidermis and upper dermis. The vaporization leads to removal of the outer layers, the epidermis, and some part of the dermis. It's a controlled delivery of energy. And of course, because there is microtrauma, there is always a repair healing process, and that leads to deposition of collagen and remodeling of the skin. So here's a patient of mine. She had finished oral retinoids. She had also done oral retinoids. She had completed the course. We also primed her for just 4 weeks with tretinoin. She was already on tretinoin, and we added a bit of 2% hydroquinone. And we started doing her sessions. I must say that during the sessions, we only continued with the tretinoin, sunscreen, and a moisturizer. We did not continue with the hydroquinone. And to our great surprise as well as delight, her delight, we found that in 6 treatments with intervals of 3 to 4 weeks, we got this beautiful result. I must say she was only 26, very compliant, was always indoors, never went out much in the sun, and she was following a good lifestyle, something important. As we know today, as longevity was discussed, we need to have a very good lifestyle to support the skin's response to the treatments we do. So 2 sessions were done with the 9x9 pixelation at 800 to 1000 millijoules, and then we decided to up it to 7x7 and went up to 1000 to 1200 millijoules, which we did very, very gingerly, but we found that she could take it, and that's because I think in between sessions she was continuing the topical tretinoin, and we would stop it for 5 days post-procedure and then restart it. So our basic protocol was to do 4 passes evenly all over with 6 stacks on the deeper scars after the 4 passes. Now we have a nice, interesting case of combining a Profilo, which we know is a biostimulator. So what we did was in this patient, she had complete very young, only 28, and then by the time she came to me after finishing oral and topical oral isotretinoin and topical tretinoin, she continued to do it even after she finished. By the time she came to me, she was 32. We'd in the past also finished microneedling RF, and this was her result before. So we decided now, she said, "Doc, please do something. You can see volume loss and atrophic scars." So what we did was we did 4 treatments of first the 2940 Superb, and because we wanted a smoother surface, we needed to have a better light reflex. And then we followed it by using Profilo, 1 ml on each side, each cheek, 2 sessions, 1 month apart. And this, to our delight, was the result. Improvement in the scars, in the volume loss, texture of skin, as well as she got this lovely youthful look to her skin. Again, even in a 32-year-old, pre-aging is very important. So keeping your collagen and your collagen bank is so important even in a young patient. So now let's go to post-acne, PIE and PIH, something which in Asians, I think, is a big problem in our, once the acne, even during when they have the acne, as well as a post-acne sequelae, something patients struggle with, so do we. In the past, peels, etc., we've done, but somehow it just doesn't seem to go. So we use our ALMA Iris SR. In the past, we've used the SSR probe, and right at the beginning, the SR probe. We don't use the in-motion. We prefer to use the stacking mode, and we do 2 passes all over. And we do know that the SR targets, it has a band range of 570 to 950, and it does target actually a lot of the chromophores, but it has an affinity for oxyhemoglobin and as well as melanin. So that's where we're using it in lower fluences and giving results to our patients. I'm going to show you a few. So we do know that PIE and PIH are more common in skin type 5 and 6 and 4 also. In India, it's 4 and 5 we do have increased melanosome size and quantity. This has been documented in papers, and it can either present as a localized or a diffuse brown to gray macular pigmentation, or erythema occurs in sites of prior acne lesions persistent, commonly involving the forehead, cheeks, and mandibular region. So here I have shown you both how PIE can look and how PIH, and also along with them you can see some pitted scars already developing. So the pigment cascade is here for us, especially in PIH. We see that in post-inflammatory hyperpigmentation, there's an inflammatory cytokine cascade from the keratinocytes, growth factors from the dermal fibroblasts. These are the risk factors, especially trauma, injury. And then you may also have a damaged basal cell membrane, which then makes it becomes leaky, and the melanocytes begin to dip into the upper dermis. And with all of this, you can get persistent PIH, and that's probably the cause. So sometimes we need technology to reach that layer, and that is where we have such good results with our SSR and our probes over here, which is that you have chromophore specificity, controlled selective photothermolysis. You see results even after 1 to 2 sessions. Reduction in, I think the most important thing is reduction in inflammation. When the inflammatory response comes down in the skin, you see a much better improvement in active acne as well as in the PIE first, and then the PIH takes about 4 sessions. So you have multidimensional targeting of vascular pigment, texture, and collagen remodeling with this probe, and which is why it's one of our most popularly used probe. Just a few tips and tricks over here. Diagnose correctly, control active acne and inflammation. In fact, after the active inflammation has come down, you can even use the iris SR to bring down inflammation further. We give topicals such as niacinamide and azelaic acid are our favorites, along with the sunscreen, and of course retinoids orally or topically. If you're doing oral retinoids, then we like to keep it at 10 milligram if you're doing the iris SR. Respect skin phototypes. Start with a test patch, not always required, but sometimes better. Conservative settings of 5 to 6. And then we go on to we use a bandwidth of 5 to 7. And that is where we find that we are safest over there. And optimize cooling. This has 100% cooling. Use it, thick layer of jelly. Don't press too hard. Keep the probe perpendicular. Don't arc it. Don't press too hard and squish the jelly. You should be able to place it on top of the jelly and move evenly. Do not overlap by more than 10%. Multiple treatment sessions of minimum 4 are required, and keep adjusting the parameters as you go along. Here is a patient of active acne with inflammation, case of PCOS, recurrent by nature. In just 4 sessions with monotherapy of just topical retinoids, azelaic acid, niacinamide, sunscreen, and barrier repair, very important lifestyle improvement because of PCOS, we found that with 5 to 6 joules per centimeter square, 2 passes, 4 sessions gave her this very nice improvement. And for the active acne that's left behind, even after doing the iris SR, we sometimes do a gentle peel with a higher pH gel-based peel. That gives a very nice improvement as well. And you can complement it on the same day. Very interesting case of post-acne nodulocystic scar. This was her after having got nodulocystic acne, I beg your pardon, followed by this scar, which was hypertrophic. This is what it looked like. It was very vascular, and it had a lot of work to be done. So we gave her intralesional steroid of 2.5 milligram per ml with botulinum toxin diluted 1:2, and perilesionally just 4 units over there diluted. And this was how she improved. She flattened out after 2 sessions. There were milia, so we removed the milia. You can see a lot of arborized vessels and vascularity. And then we started doing our iris SR. We did 4 sessions, 3 weeks apart at 5 joules per centimeter squared. We made a template, placed it over the scar, and then we found that these were our dermoscopy findings. And now you can see that from here to here, there's such a good improvement. Yes, thank you. So you can see a nice improvement, decreased vascularity, and she was extremely happy. And this all happened within 4 months. So now let's go to pigmentation with the Clearlift Pro, a big problem in our country. And with the Clearlift Pro, we are using the photoacoustic effect. And here your target is, of course, pigment. And this is how it fires. It has multiple settings from 0 to +1, +2 to -1, -2, 0. And the whole idea is to start with 0 because that's your base level, very safe even for a beginner. It's a very high-powered probe and it's fractionated, which makes it safe. So you're getting you're getting focused delivery of energy. And you up to starting with 100 microns, and that's the starting point, and it goes to a depth of 2,500 microns, and you do not get any epidermal crusting, and at each focus delivery, you're getting 130 joules per centimeter per pixel with a nanosecond pulse duration. And this is what it looks like over here. And this is how you create, again, microtrauma, microstimulation, as well as some of the pigment can also begin to escape. The indications are basically melasma, dermal melanosis, pigmented acne scars, and PIH. And these are our settings. We can talk about them maybe in the question and answer. But classically in melasma, we use 400 to 600 millijoules. And when we have, I'll show you some other indications. And we use the settings of 4 hertz up to do 600 shots once every 3 weeks over 4 to 6 sessions. And we give a patient a break after 4 sessions usually. And the whole idea is to keep the spot size at 5.5, larger spot size. This is how conventional works, and it's similar with the fractionated. You do gentle passes all over with not more than a 10% overlap. And this is a patient of dermal melanosis. We did give her a topical hydroquinone, retinol, and a sunscreen before, and she continued it even in between sessions. We gave her a longer gap of 4 to 6 weeks and an energy of 700 to 1,000 millijoules per second, about 3,500 total shots. Started with 0, went down to -1, and with subsequent sessions went down to -2. This is a case of melasma I have mentioned over here. 1,200 shots per site at a focal depth of 0 to play safe. 4 sessions, nice clearing. And this is a case, resistant melasma. We've done nothing else except sunscreen, moisturizer, and then we have done our Clearlift Pro and followed it with mesotherapy, all the newer cocktails. And let me say that let light lead the way. You've seen the results. Exceptional results are born from precision of delivery of optimal energy, which respects tissue and makes it simply intelligent. Thank you.
Thank you very much, Malavika. That was fascinating. And I'd like to invite on stage Dr. Ri from South Korea.
Okay. Thank you, Chairman. I only have 12 minutes, so I'll start fast. So is there anyone interested or heard of titanium lifting here? No? Okay. So what I'm going to talk about is Korea's aesthetic edge, the evolution of soprano titanium treatments, titanium lifting. I'm board-certified dermatologist and currently the coordinator of Korea Derma 2026. So let me start with this short video. Can you, music please? No sound? Thank you. Yeah. So titanium is the king of lifting, and we have stronger handpiece using right now. So let me start with titanium lifting. So it only needs around 10 minutes of the treatment. And well, in Korea, our patients are so impatient that they want some effect to come out really fast. So it's called 빨리. It's hurry. And they're very impatient in terms of pain as well. So we have very low pain tolerance. So that's why titanium has got its popularity in Korea. And current evolution of aesthetic goals has shifted from the younger generation seek aesthetic treatment before visible signs emerge. And we call it pre-zonation. So it is beyond fixing wrinkles to collagen banking. And the role of energy-based devices are ideal for this purpose. And this would be three different categories: ultrasound, radio frequency, and laser. And with laser, the soprano titanium could be one of the best one that we use for this purpose. So soprano series is a well-known device for hair removal. And the titanium is the latest version of soprano series here. So when I first heard of the idea from the Ms. D there from ALMA Korea, that they want to use soprano titanium, the hair removal laser, as a skin lifting and tightening purpose, I was like this, what? But if you take a look at this, so this was just 10 minutes of the treatment, and you can see her nasolabial fold has been improved, and you can see a nicely contoured jawline. And her skin tone has been improved, as well as the skin texture. Yes, it works. Then the question rises, how does it work? So like 3 years ago, I had a chance to have a talk with Professor Rox Anderson, and I asked him, how do you think of using hair removal diode laser for skin lifting and tightening purpose? And he said, oh, yeah, that makes sense. So when we think of the basic laser principle, the hair removal and laser skin lifting and tightening, they share the same principle called extended theory of selective photothermolysis. So unlike the theory of selective photothermolysis, with extended theory of selective photothermolysis, the chromophore and the target is different, so that the heat is diffused from the chromophore to destroy the target. And when you see here, so hair reduction, the heater or the chromophore will be melanin in the hair shaft, and they're gonna destroy the nearby hair follicle. And you can see with non-evolutive skin rejuvenation, the chromophore are hemoglobin in capillaries, water in cells, and melanin in the epidermis and dermis. And they will in turn diffuse heat to nearby collagen and elastin and start wound healing and to make new collagens. So then another question rises, can all kind of hair removal lasers can be used for skin lifting and tightening purpose? I guess not, because soprano titanium has several features suitable to use it as a skin lifting and tightening purpose. First, they emit 3 wavelengths all together at the same time. And they have 2 different treatment modes. Actually, they have 3, but we use 2 modes for skin lifting and tightening, the S-TEC and SHR mode. They have equipped a very high repetition rate, up to 10 hertz, and it has very powerful cooling system. So let's see, take a look at about the wavelengths. So they have 1064, 810, 755, and they're emitted all together at the same time, not one by one, but all together. And we all know that the longer the wavelengths, the deeper the penetration. So the 1064 is for the deepest part, 810 for the middle, and 755 is for the superficial structure of the hair follicle. And it is known that when the wavelengths are blended and emitted all together at the same time, it is more efficient in heating of the tissue. So we need less energy for each wavelength, which means it will have a greater safe margin, and it will have less painful treatment, and it will have still efficient in heating of the tissue. And they have 2 different treatment modes. So one is stack mode, and the other is assertion mode. So with stack mode, we use stamping technique. So it will ensure uneven and focused heating of the tissue in the areas over ligamentous structures, or even the fatty areas like jaw or submentum. And with SHR mode, we use in-motion dynamic technique, so all over the face. So when the pulses are stacked, then it will increase the tissue temperature because it will have less time for the heat to be dissipated. And when we use SHR mode, the intensity and depth of heating can be adjusted by controlling the moving speed of the handpiece. So if we move slow, it will ensure deep tissue heating. So it's going to be similar to stacking, in fact. And if you move fast, then it will ensure the superficial heating of the tissue. And I think the SHR mode can possibly induce follicular stem cells with the induction of heat shock proteins. And we have very good cooling system, negative 3 degrees Celsius. And these will be maybe 4 different devices that we can use for skin lifting and tightening. And when you see here in the green, it is long pulse tensible laser. And you can see the pulse duration is short and the peak power is high. So it can be effective, but in terms of treatment window, it's gonna have like a more risk of burn, so it's not safe. But in terms on the gray is titanium, and you can see it has lower peak power and it has longer pulse duration. So it's much more safe in terms of treatment, but we can still effectively heat up tissue because it has a high repetition rate up to 10 hertz, so we can treat in a very efficient way. And I want to talk briefly about radio frequency. It's unlike the laser system, the radio frequency. When we treat with radio frequency, it depends on electrical conductivity of tissue. And more heat will be generated in the area where large current flow, where resistance is low. Which means, the radio frequency, there will be inhomogeneous heating of tissue. So it depends on the electrical conductivity. But with laser, long pulse laser like titanium, is relatively homogeneous. So where there is a crown floor, there will be heating. So it will be like this. So ultrasound, we have focused heating of the tissue in the specific depth. And radio frequency, we have bulk heating, but it depends on electrical conductivity of tissue. But with long pulse laser, it will still have a bulk heating, but it is relatively homogeneous than our radio frequency. And I'll briefly talk about the aging phase. And well, when our tissue age, every tissue on the face drops down. And there is an important structure in our skin called retinaculate cutis fibers. It's in subcutaneous fat layer. And with aging, these retinaculate cutis fibers tend to decrease. And it is associated with the degree of sagging as well. So what I thought about the targets of titanium lifting was that to target the retinaculate cutis fibers. And here you can see the retaining ligament here. And this is retinaculate cutis fibers in the subcutaneous fat tissue. And you can see the retinaculate cutis fibers just above the retaining ligaments are more densely arranged and vertically oriented. So if we want to target the retinaculate cutis fibers, it will be more feasible to target where retaining ligaments are, where retinaculate cutis fibers are really abundant. And second target, yes, we have retinaculate cutis fibers in the subcutaneous fat tissue. So it is feasible to target where excessive fats are. And when we target there, it will contract the retinaculate cutis fibers and result in contouring of the face as well. And we have platysmal auricular fascia just in front of the ear, which is very thick. We use it to fix our threads or something. And fourth, yes, titanium is a hair removal laser. So I think the hair follicle is the target. And we have a lot of collagenous structures in the hair follicle as well. And when we contract these collagenous fibers, then it will result in improvement of pores, textures, and it can still possibly induce follicular stem cells and rejuvenate our skin. So based on these hypotheses, I tried to target first the retaining ligaments, and second, where excessive subcutaneous fats are, like jowls or submentum. Third, platysmal auricular fascia, and fourth, the hair follicles all over the face. So this was actually the basic protocol that I start with stack mode first and then SHR mode. I'll show you with the video. And there was a need for more stronger treatment. So there is a intense protocol like this. So these are practical safety and effectivity tips that you should strictly avoid tattoos, bruise, or stubborn melasma. You should protect the hairline, eyebrows with paper tape. Avoid immediate treatment after injectables because it will have a risk of burn, deep burn, and avoid immediate treatment after injectable, so extraction with energy titration over pigmented lesion. And topical anesthesia is not mandatory, but if you do, then patient will be more comfortable, and you should maintain full contact for safety and efficacy. I'll show you the treatment video. So the stack mode is quite easy. You stack the pulses on the problematic areas like zygomas, and jaws, jaw lines. So I use stack 5, which means the 5 consecutive, so stack 5 with 2 stacks per point, which means there will be 10 consecutive pulses, like and then I use SHR mode, and it's a moving all over the face. So I'll skip this one, this. Let me just see some of the results. So I treated her left side, and you can see asymmetry has been much more aggravated. And you can see, after treating both sides, you can see the nasolabial folds improved, jawline improved, and the skin has been much more brighter. Another case is immediately after. You can see nice contouring effect, and when you see the vector, it's much more like upwards. And this is after 4 weeks. You can see nice contour effect. So the advantage of titanium lifting, we could have an immediate result with short treatment time, with minimal pain, no downtime, and no consumables. And still remember, BTS, brighten. It will brighten your face. It will tighten your face, and it will contour your face line. Thank you, and please join us if you have time for Korea Derma. It's December 11th to December 13th. Thank you.
Thank you very much to the King of Lifting. I'm just reminding you that you have the possibility to send us questions through the app, through the Q&A that we will have. And I'd like to invite on stage Dr. Lim from Malaysia.
Right, I'm so glad I did after Dr. Ree. He just covered almost everything. I don't need to do much then. So this is me. I'm an aesthetic physician from Malaysia. I basically work with multiple companies, as well as today we'll be focusing on the ALMA Soprano Titanium, as well as another injectables called Profilo. So we saw earlier how Dr. Ree mentioned about connective tissues and also the reticular cutis. But in real life, when we actually flip out the skin, what we see underneath is not packed of tissues, of fat cells. In a living person, they are built with connective tissues that are forever living. It's forever moving. So a lot of times when we look into fascia ligaments or retaining ligaments, we used to think that they are the sheath of white shit. But in fact, they're actually connective tissues that actually made out of this particular structure. This structure has lots of function. Not only they are building the structures, they are forever moving. As you can see here, they are moving in a way that continues to find a new balance, a new equilibrium. And you sometimes can see cells migrating in these connective tissues. These connective tissues generally is what made out for the volume of face. Not your fats, not your cells, but the connective tissues. Because these connective tissues are everywhere, but cells are not. We used to think that cadaver, because our knowledge of understanding human anatomy was based on cadaver for the past 500 years, that is post-mortem. It's very dehydrated, everything is gone. What you're seeing is just flat. Because what we are doing is studying grapes, looking at raisins. But in real life, they look like this. Small cells, pockets of cells on certain areas, but lots of empty space. We call it interstitial space. And this is where it gets interesting. It goes into the fats, into the muscles, and down to the bone. This video was taken by this particular hand surgeon from France. His name is Jean-Claude Guimbartou. He has been doing it since 30 years ago. And some videos go way back 30 years ago. And it really tells us what we see on the skin is merely a whole ecosystem down beneath, down to the bone. Whenever we stretch our skin, whenever we push our skin, they are actually working on this particular space that allows these connective tissues to behave. And why is this important to know this? Because these connective tissues are the one that feeds our cells. Connective tissues are intertwined and connected to our cells through the integrin. The integrin is connected through the connective tissues to our cytoskeleton, and this cytoskeleton is actually sends signals to our nucleus. That's why we create proteins. That's why cells behave the way it should be because of the connective tissues. You take the cells out of the connective tissues, they don't behave the same way anymore. And you've seen this earlier, these connective tissues is not fixed and static. Every time it starts moving, it will never go back to the same place anymore because it continues to find a new balance. And therefore, our whole body is a tent. It's not full or packed with layers and layers, but it's a tent with lots of empty space to allow our tissues to behave the same way. So, we used to think that our body was packed with tissues, and we think aging is equal to tissue loss. But that's wrong, because the whole body is built up by this tenting hydraulic system. And whenever we put volume into it, what we are doing is we're disrupting this whole tenting system. And that's the question. Is our body being held up by the bones, or our bones held up by the body? In fact, if you don't have your connective tissues, your bones will fall on the floors. It will not stand up on its own. It's the connective tissues with its hydraulic system, we call it tensegrity, that actually builds and holds everything together. And with aging, because the connective tissues, as we saw earlier by Dr. Ree, it collapses. It starts to shrink. And therefore, we should not talk about layers anymore. In the body, there's no layers. There's a lot of connective tissues. There's one single continuity from the skin to the fats to the muscles, and lots of empty space down to the bone. Even the bones in real life is moving. It's not the static like we see, because the bone that we study are all dried up bones. And there's another cell that plays a part called fasciocytes. They are the one that lubricates these connective tissues. They play a big role in avoiding dehydration of the skin, of the connective tissues. When the connective tissues are dehydrated, that's why it collapses. And why am I talking about this? Because now we have two technologies that plays a big part into remodeling and improving the connective tissues. Most people talk about titanium lifting about the 3 wavelengths, but there's one thing that's even more powerful: the cooling system. Do you realize that cold itself is a perfect bio-remodeling and biomodulating sort of technique? So we have 3 wavelengths shooting together, helping connective tissues to vibrate. Because of the vibration, that helps us to make the ECM healthier again. Second, the cooling, the power cooling of this device create what we call cryomodulation. And this also helps us improve the connective tissues. And on top of that, you can also use injectables, such as Nahiko's technology. This is Profilo. This is one of the inventor, Professor Chiara. She's from Naples, Napoli. She's the one who came out with this technology. And what it does, it helps to improve the microenvironment inside our tissues. This is one of the publications done by another doctor in Seoul, looking into the triple wavelengths that change the cortical thickness of the bones. Do you think that the lights go deep into the bone? They might be, but we could have done a vibration of the connective tissues because it all links down to the bones as well. So could have the vibration of your connective tissues helps to improve the connective tissues in the bone itself? And this is an interesting question. I like to do, so this is, hopefully this video runs. Okay, this is using the HSR mode. I tend to use this more often because it's actually quite gentle to the skin. And then this is the injectables. I do it, you can do it before the injectables, and as you can see, the skin quality improves. And also you have the lifting effect that lasts for a longer period of time. It's sort of synergistic because not only we are trying to vibrate the connective tissues, we hydrate them. We allow them to get raw materials to build up the glycosaminoglycans of your connective tissues. And this is where I find that combining a technology like this together with injectables, we probably find a way to make our ECM healthier again. With that, thank you very much.
Thank you very much, Dr. Lim. And I'd like to invite our last speaker for today before we'll continue to a Q&A, all the way from South Korea, Dr. Ko.
Thank you for introducing me, and thank you for Dr. Ree and Dr. Lim for doing all the difficult stuff for me. So I'll just keep in the safety and easy, practical way of using titanium. Thank you. And my name is Bomjun Ko from South Korea. In Seoul, we have a lot of in Korea we have a lot of devices, so we could simply say that we are living in a flood of devices, and it's really hard to decide which treatment to do. So it could feel like something like a painter in front of a canvas, not knowing what to draw and when to draw or which tools to draw with. So we had to differentiate ourselves with multiple analyzing modalities and reports to help the conclusion of our treatment. So this was our first slide to fully understand the patient's concern. And when I'm doing the consultation, I divide my my treatments into three big categories, three big axes. The first is contour. If we fix the contour, we could make them happier, make them more beautiful. If we improve the surface, like pores, pigments, scars, redness, we could improve the result. And of course, we could change the aging sector. And I've divided these treatments into three sectors, as you can see, with the visualization map. So I use this map to consult the client regarding the concerns. And of course, I have a visual aid to fully make the customer understand which part of the layer I'm treating with injectables and with lifting devices, EBDs. So here you can see the titanium is on the upper side of the device layers. So when someone has concerns regarding the superficial layer of the skin, I always recommend the titanium with a check here. And of course, these devices penetrate into different layers. So I would also add on this slide to make them understand which devices are being treated with. And if I see this map again, we encounter a common situation when people don't want pain and don't want any downtime. So a lot of treatments are getting erased. And as you can see, my beloved treatments with ALMA devices, tuned face, and titanium are still here, which means they are painless and they don't have any downtime. So I've listed some common situations when titanium is considered first in my brain, in my mind. So when people don't allow me any downtime, or if the pain is a deal breaker, I always bring up with the titanium first. And then when my clients want a wide canvas, for example, if they want to treat the neck as well, or probably the décolleté, or probably if they have concerns regarding their body, armpit, arms, bellies, buttocks, anywhere you can use it around the body because it's so quick and safe and efficient to use titanium. And if the client wants a faster result, perhaps if they want to have like a revenge on their ex-boyfriend on the wedding with a mutual friend, we will want to use titanium really quickly. And then if someone wants to have improvement on the pigmentations as well as the aging process, we always bring up with titanium first. So if we see this Venn diagram again, I think titanium is right in the middle. So we can fix the contour, we can fix the surface, and we can also help them with aging. Yes, I'll have to be quick, sorry. Yes, I've done more than 10,000 of sessions of titanium. That will be roughly more than 3,000 cases, patients in our clinic. And Dr. Ree, thanks to Dr. Ree, he provided the signature version of the titanium. And this is how I do it. I want to share how I use it. And just like Dr. Lim, I use SHR mode more predominantly, because I do agree that SHR mode is more gentle and it's more painless. So I go with 60 kilojoules of SHR first, and moving right to left, right to left, right to left. So I break down with 10 kilojoules. So the first round I use 10 kilojoules on the neck and the face, and then go left. And then when I go back to the right side, I use it on the forehead and the face, and then you get the point. And then after 60 kilojoules, I move on to the stack mode. And if you do the stack mode properly, for about like 4 to 5 joules per square centimeters and 4 to 5 stacks, it could have a bit of pain, just not so much that you have to numb your patients, but a bit that could be possibly have like a simple short time of pain. So I always explain that before I do the stack mode when I'm doing the SHR mode gently. So when I move on to the stack mode, I would focus on the areas where I would use the HIFU. And this is how I do it. If you just, can you move it to the 2 minutes and 15 seconds? Or can I do it here? Yeah. So what I'm trying to do is glide on the surface of the face, because the face is like a three-dimensional dome shape. You don't want to press hard and be on a 2D space. So if I see that again, I'm trying to smoothly glide around the face. And this is the right immediate effect of the titanium. So as you can see, right after the titanium, just a single session like Dr. Ree mentioned, 10 minutes, she could have her revenge back to her ex-boyfriend right away. Yes, today we are trying the stronger version, hyper version with a big handpiece. And as you can see, you can use it on the bodies as well. It's really efficient. And one thing I wanted to fix is a common misunderstanding about titanium, that it lasts so short. So everyone who comes to our clinic claims that, isn't titanium too short? And I have to explain every time that it has two different dimensions of effect. So right after the titanium, it has immediate tightening of RC. Dr. Ree mentioned this before, so I'll skip that. And That lasts about 1 or 2 weeks. But that's just like an additional bonus. That's not the conclusion. So if we repeat the titanium, we have a cumulative effect of brightening and tightening. And I wish every clients had a maximum effect after 3 sessions, but in reality, we had to use several sessions more to reach the maximum effect, and then the degradation differs from person to person. And yes, I'll have to skip about the effective scientific background, and I'll show you some combination I use commonly. So when I use the combination, I always use the bulk energy before coagulative energy, and I use energies before injections. So when you have to use titanium and some coagulative devices, painful devices at the same time, I really don't want to do that, but there's some cases you have to do it at the same time. So in that case, I use titanium first before I numb the patient, because I want to remain the titanium, the course of titanium to be painless, and make them remember that titanium is painless and they want to come back. And if I have to use boosters, skin boosters, collagen boosters, I use it after the titanium. Dr. Ree mentioned this earlier. And if I'm combining some low temperature treatments, I don't really mind about the order. So a common device I use a lot with will be Axin Prime. Your version will be the latest one, Prime X, on the slide. This is the Prime X. And a lot of times I use PLLA injections as well. So Axin Prime Tune Face Prime X is a very unique device. As Dr. Ree mentioned again, it uses unipolar RF, and so it can penetrate more deeper than titanium. So common handpiece I use a lot with titanium is the Tune Face. And also I have a report for the Tune Face as well to make the client understand what we're doing. And if I show you how I use it, so I use 2 devices at the same time to avoid the loss of heat when I'm alternating. So this device, this particular Tune Face Tune Blue device penetrates about 11 millimeters, which is over titanium's depth. So this is a device I want to share when you want to improve the contours even more. And I'll skip the scientific backgrounds. And one thing I want to add is right after titanium, I love to use ligamentous injections of PCL. This is getting common in Korea as well. It's really quick and effective, and it has like less pain. And I'll show you my cases. This 40-year-old lady has used a lot of Tune Face and titanium sessions. So as you can see, I repeat titanium a lot, and throughout 2 years, she hasn't aged a bit. And it works for late 40 ladies too. She was under lots of Tune Face and titanium sessions along with PLLA and PCL injections. And as you can see, she's really satisfied with the contour and the texture of the face. And also, I combine Tune Face and titanium to mid-50-year-old ladies, and it works too. As you can see, the laugh lines and the tear trough and contour is improving. And it has also moderate effects on an elderly person. So I combine it with Tune Face and titanium and PLLA and PCL injections also. And this case was done with only titanium and PLLA injections. And as you can see, her skin is brightened and the contour is better. This picture was took before the 3rd session, so it has only the long-lasting effect. So it means, like I said, titanium has long-lasting effects too. It can prove that. And also, I'm using titanium and Tune Face on my face too. This is me. As you can see, my skin laxity and contours are improving. I think my skins are great considering my age. So if you think of this Venn diagram again, I think contour surface aging, the titanium lies in the right middle, so you can improve 3 axes in the same time with safety and with a quick result. So I've named it as like slow aging, well aging. Thank you for listening.
Thank you very much, and I'd like to invite all speakers to the stage for a Q&A. We received some questions already through the app, and there's an open mic in the middle of the room if any of the participants here in the room would like to ask some questions. So welcome back, everyone, and I'd like to start with Dr. Lim. There's a microphone on the table, please.
Sure.
Questions that you received.
Right.
What is the reason behind doing laser first followed by Profilo injections? Can it be the other way around? If yes, why? And if not, why not?
Right, so the rationale behind it is I feel that we can stimulate with light first. And a lot of times, if you actually already put in substances inside, you could actually create a microenvironment that responds slightly differently. So initially, the thought about using the triple wavelength lights is that you can work on opsin. It could have a vibratory kind of effect to it, of course, the cooling. But what if you actually place substances that doesn't run the same way as your tissues? It could react differently. And what just now Dr. Ree had mentioned, if you actually put skin boosters and you run it, because the tissue now are more sensitive perhaps to the light, you can actually create burn cases because now it evaporates and then it just hurt the tissue. Secondly, it also hampers lights from going in the right way. So the empty space allowed the lights to travel deeper down to tissues. So therefore, it's best not to manipulate the tissue too much. I don't use numb cream. I actually allow the tissue to be as it is and run it. If we were to do it before, you can prime the skin 1 or 2 weeks beforehand. Makes the ECM healthier first, and then do the treatments later. You don't have to do on the same day. If you do want to do on the same day, I'll suggest you do the laser first, then followed by the injectables. I hope that answered the questions.
Thank you. And I have a question for Dr. Ree. So answer your question and add additional. Okay. So you have also a question that received from Dr. Monica. Are there chances of paradoxical hypertrophies?
That's very frequently asked questions from Europe whenever I go. So yeah, there is a chance. And actually, the Ms. Lee, her husband has paradoxical hypertrichosis.
A walking
so
example.
yeah, so there is a risk. So we have to warn the patient if the patient has really thinner hair. And well, if the hair is extending to, especially for female patient, if the patient has really thin hair and it's extending over like her shoulder or something, then there can be a risk of hypertrichosis. So we have to warn, but we can still treat soprano titanium because it's a hair removal laser. And second thing, I want to just add on to the injectable. So when you do the titanium, especially titanium, after injecting something like even the toxins, the fillers, or skin boosters, then as titanium has 3 different wavelengths, it has high risk of burn because it has 1064 especially. So I recommend you never do the titanium right after injection. And in Korea, we have a severe cases of like a 3rd-degree burn because they said like a burn is upside down, inside out type of burn because the material is injected deep into the tissue. So never, yeah, it's the only thing I always emphasize with titanium.
Okay. In regards to the priming, we have a question to Malvika. if you can describe the priming that you are doing to your patients.
Sure. So earlier, in some of the earlier cases, we would do for skin of color, we would use a retinoid. Topical tretinoin is preferred, 0.025%, because we're going to do a procedure, so we don't want to cause any redness or dryness or irritability of the skin. Along with just 2% hydroquinone, again, just for evening out the color, along with a good moisturizer and sunscreen usage has to be really good. That is emphasized, and also we tell them to plan doing the treatment when they're not going to have a vacation in the sun, preferably in India when the rains are there, or maybe if there's a winter, then in cloudier days is preferable, especially if you're going to do the ablative laser. However, nowadays I do not use hydroquinone. I prefer to use the brighteners and lighteners, like I prefer azelaic acid, niacinamide, maybe some kojic acid, arbutin, which you can also not only use for priming before the procedure, but even post. Even thymidol is very useful. You can use it even 48 hours after the procedure, so you can institute them earlier. Azelaic acid is easy to add. So I actually now prefer these to hydroquinone. I've almost gone off hydroquinone completely, but I do continue the retinoid in between. But I may give them sometimes in skin with already which has barrier dysfunction, then I may even stop the retinoid till the treatments get over, maybe 4 sessions, and then restart it.
And another question for you in regards to PIH management post-superb. Post-superb.
Post-superb would be similar. And I think the most important thing is making sure that they heal fast, not allowing and not going too aggressive. So I think don't overstack. I think that is very important.
Okay, and questions to Dr. Ko. If you can share in your own words what you are telling patients when they are coming to see you and they don't know what titanium lifting is. What are your goals?
Yes, of course, nowadays in Korea, there's less people who don't know what titanium is. So first of all, they all know what titanium is, and they just don't know which devices to choose. So that's why I started with the slide that separates my treatment. And as I follow my treatment map, I reached to the conclusion, and I checked the devices, and I put it into the basket, like a market basket, and then explain which devices that I can use right now if you don't want like downtime pain, and which devices you could use in cases of like if you have a window of superb pain and downtime, we could divide these devices into this case and that case, like that. So I don't really think there's a simple answer to devices or treatments. I just think that there's some circumstances that we can choose properly.
Okay, there's another session afterwards, so we'll have to wrap it up. So I'd like to thank all 4 wonderful faculty. Thank you very much.
Thank you very much.